Can I tell you what my current anxiety is?
Yes.
I just need to get this off my chest. But like right now, for example, my current anxiety, like not even kidding, and it sounds so dumb and so first world problem. I'm just saying that ahead of time. Okay. So for anyone, sorry.
It's behavior, bitches.
Hey guys, it's Liat. Welcome back to another episode of Behavior Bitches Podcast. We're here and ready to go with a topic that I think a lot of people will relate to. I don't have the issue, but I know everyone else does. I can't imagine what it's like to have anxiety. I'm just kidding. We're all about being real, raw, and relatable. That would make me like the least relatable person if I said I've never had anxiety. Our guest today here talking about this with me is Dr. Nicole Cain. She is the author of Panic Proof, this book that I'm holding right here. And if you don't see it, that's because you're obviously not watching on YouTube and you obviously haven't subscribed to our YouTube. So go ahead and do that right now. She's a leading expert in trauma-informed and integrative approaches for mental and emotional wellness. With a degree in clinical psychotherapy, training in EMDR. Ooh, we could talk about that too. I did EMDR and I could only speak so highly about it. And a license as a naturopathic physician in Arizona. Her approach to mental health is multidisciplinary, medical, psychological, and holistic. Dr. Nicole Cain, welcome to the show.
I'm happy to be here. Thank you.
I'm so happy to have you. And before we get started and get into all the details that I think everyone's going to want to know, I always like to what we call in behavior analysis pair a little bit first. And so I'm going to ask you some questions that are not related to anxiety at all, unless these questions make you anxious. I'm not sure, but they're just kind of fun getting to know you a little bit. So what was your last ChatGPT search?
Strategies used by the Chicago mob in 1945 to launder money.
How did you end up on that?
I know, it's like such a weird thing. I'm actually writing a book. It's a historical fiction book, and it takes place in Chicago with the mafia in the 1940s.
You have range. Like you went from writing this Panic Proof to a historical fiction?
Yeah. I feel like I'm just on a train and I'm just holding on for dear life. And we're taking stops and they're very unexpected.
Wow, who knew that would come out? Okay. Tell me how you start your day. What does it look like when you wake up?
I wake up and I have 2 Cavapoo dogs, and the door opens and they come bounding in and they jump on me in the bed. And so I get dog cuddles and I have coffee in bed. And then I know the day is going to be great. So that's how I started today.
Wow, I love that. Okay, so that's your every day.
That's every day.
Amazing.
Yeah.
Okay, and now, sorry, I have a list of questions I'm really having to. Let's see here. Okay, if you were stuck on a desert island and could only bring one book aside from your own book, Panic Proof, what would it be?
Probably A Confederacy of Dunces. Have you ever read that?
You are interesting. No, tell me.
It's written by John Kennedy O'Toole, and it is altogether one of the funniest books that have ever been written and one of the most tragic. And every time you read it, you love the protagonist, but also you hate him and he's a disgusting asshole. And so this book, I just love so much. It's so rich. It's like the fullness of the human experience. And so I would bring that. You should read it. Everyone should read A Confederacy of Dunces.
Martha, have you read this?
No, but I know of it.
Martha's the English major in the office. So I would expect her to have read it. I'm a little disappointed that she hasn't. But okay. Anyways. All right. Okay, my last thing. Sorry, I didn't mean to do so many of these. I usually only do like 2, but you're fun at answering these things. What's something about you that most people wouldn't guess?
I studied vocal performance before I decided to become a helper, before I decided to go to counseling school and medical school. I was going to be an opera singer.
Whoa. You really you had that ready to go. I like that. That is definitely part of your 3 truths and a lie. Am I right?
It is. I use it often. I recycle it often. But now that I've said it on your podcast, and your podcast is like the most famous, big, huge, amazing podcast ever, I'm gonna have to change
Yeah, you better
my
change it
answer.
up.
Everyone will
If you
know.
want
Yeah.
if you want, I could have Alan delete that.
Delete it. No, just kidding.
It's behavior, bitches.
Are you a BCBA now and you are sad because you hate your job? Are you thinking, I worked so effing hard and here I am, dreading Monday? Well, you're not the only one. We get that message all the time and we decided to do something about it. Welcome our newest baby, Pair ABA by Study Notes ABA. What is this? Well, we pair you with jobs that you actually don't hate. Imagine that. Imagine going to work on Monday and being excited about it. Imagine working somewhere where you're appreciated, you're paid well, they're doing ethical practice, and you love what you do. Well, that's not impossible because we have formed Pair ABA, where we talk to clinics that we would actually want to work at. We're not going to send you anywhere. We are assessing these clinics to see, are they doing the good work? Are they not telling you one thing and then having you do another thing once you sign on? If you're concerned that you're not happy or you're feeling unsettled where you are, don't settle. Don't settle in relationships. Don't settle in work. Realize your value. Let us help you find a job where you are happy. All you need to do is head on over to pairaba.com. The response effort is low. Fill out the form so we can help you find job options near you. If you're a clinic and you think you're good enough for us to place at, also head over to pairaba.com. And we will see, are you good enough for our badass BCBAs who we protect? Go check it out, pairaba.com. Love you, mean it. Amazing. Okay, well, let's get into all the good things now that I'm first of all, can you tell everyone when this Panic Proof book came out?
Yeah, October of 2024.
Wow, and it is a thick book. Like this, how long did this take you to write?
You know what, my friend? It was 9 months, but in all fairness, I've been writing a lot of the material in blogs and handouts for a super long time. It was all stuff that I repeated a lot. So it's not as much of what is it, like a pat your own back by saying 9 months, because really it was probably years.
No, but it doesn't matter. Like it's still about putting it together. Like I could talk about behavioral stuff and I could say that I've done so many, but it's about taking the time and sitting and putting it together for someone to read in one space.
Yeah. Yeah. Thank you. It was 9 months of putting it together and making it legible for other humans.
It's incredible. So tell us a bit about what you do and your background. Let's start with that.
My practice in my background is I'm trained in undergrad. I studied psychobio neuroimmunology, and that is the study of how the immune system, our nervous system, our body, and our mind all work together. And I didn't really like standard medical care at that time for mental health. My experience growing up in a family with lots of anxiety and generational trauma was you just suppress it, talk yourself out of it, or take a pill and see you later kind of a thing. And so I decided to do psychotherapy instead. So I studied counseling. But all of that changed when I was working in Lake Forest, Chicago at a rehab with adolescents. And so we were in group therapy one evening. It was like 8 o'clock at night. And I have my group of like 15 to 20 adolescents. And we go around the circle and we start with, what is your drug of choice? What is your name? What is your drug of choice? And how long have you been sober? And the girl who is sitting next to me was drinking a Monster, Red Bull, whatever it was that was popular back then. This is in 2006.
It's always changing.
It's always changing. Whatever it was, is she was like jazzed. And her drug of choice was cocaine. And so she's jazzed and she wasn't sober. And so she's expressing that she can't sleep and she's experiencing anxiety. And I'm like, maybe you should cut back on the caffeinated drink at nighttime, but that's out of the scope of a traditional psychotherapist. So we referred her to her psychiatrist who prescribed her Ambien, which Ambien is the drug that Roseanne Barr said that made her racist. Do you remember that whole Twitter
I didn't know
scandal?
that.
Yeah, it's like a sedative hypnotic drug. It's a controlled substance. Some people have very
Trust
goofy
me, you don't need to explain any pharmaceutical drugs to me. I am your perfect case study of what not to be.
what not to be. And so she came back and now she's on cocaine, drinking caffeine. She's on a controlled substance from her doctor. And I thought that this was just an outrage. And I didn't want to be a part of a system where that was just the end of the conversation. So I got on Google and I found Naturopathic Medical School. And in Arizona, there's Sonoran University, which is a federally accredited medical school where I would obtain a national provider number, a DEA number, and all of the rights of a physician.
So then you
to
could
help.
prescribe Ambien. Okay.
Then I could prescribe Ambien. So I go to naturopathic school, and the TLDR, the too long don't read, is that I became the expert in a system that I was fighting against. But we perpetuate that which we know, and we have our own flavor until the pain of perpetuation outweighs the pain of doing something different. And that's what happened to me is I had essentially a nervous breakdown in 2015 where I stopped sleeping. I was having constant horrible panic attacks. I lost so much weight, I stopped having my period. And I had that opportunity, and I don't know if you faced this with your story of I could keep doing the same thing and the way this is going to end is not what I want for my life, or I could do something different. And so I changed everything. I started asking questions. What is my anxiety trying to tell me? What is my body trying to inform me needs healing and how? And that was the birth of this more vitalistic, holistic paradigm that is panic proof, which you see in the pages, is it largely debunks everything that we've been told by the standard healthcare system.
Right.
And how the science proves this new paradigm works is correct and how people can get better. So that's kind of the long answer to your question.
No, that's a full answer. And my ADD here, also treated by drugs. I'm going to go back. There was a few things I wanted to ask you in there. So first of all, for anyone studying for the exam, there's two concepts we talk about. We talk about parsimony and pragmatism, that sciences lead with these attitudes. And what you just said is a perfect, and that's one of the most confused concepts when I'm teaching. And I would say you just gave the most perfect example of parsimony. So anyone studying, here you go. You ready? She was saying like, this girl's coming in, like, I just have all this anxiety. I don't sleep. I don't do any of this, right? Like the most like parsimonious explanation would be like, well, maybe you're using cocaine and drinking monster drinks at night. That's parsimony. Now, pragmatism is going to come to the actual intervention point of it, right? Like, what is going to be the most pragmatic approach to fixing this? And that is actually where we're going to find out more about actually looking at the right, like, what is the function here? What is going on? So that, number one. The second question I wanted to ask for you, sorry, that was just a teaching opportunity for anyone wondering the difference. If you don't mind me asking, just behaviorally, I am curious, what was the antecedent or trigger for this anxiety attack that you had in 2015?
I think it was a cumulative. There was a straw that broke the camel's back. And I think that it had been, like the frog boiling in water. It's like getting hotter and hotter and hotter, and you don't realize it until you're boiling. I think it was something like that. But the primary antecedent was that I had signed up and created an integrative mental health medical practice with a colleague, and I bit off way more than I could chew. And so I had $3,500 in expenses a month, and I wasn't getting enough patients in to make that rent. Plus, my student loans have gone into repayment. Plus, I thought that I was dumb and worthless because of my childhood trauma and incapable of being successful. And all of that stirring together. I had a bad night of sleep, another bad night of sleep, and then I became terrified about getting bad nights of sleep, which made more bad nights of sleep.
I
And
totally
then,
resonate with that. Wow.
oh, it was awful. And you can't just avoid. It's like if you have a fear of flying, you could just not get on a plane. But I was faced with it every single day, and I remember this feeling of doom as the sun would set, and just knowing tonight I'm going to be riddled with terror and anxiety and involuntary body jerking and twitching, and it was just terribly awful. I wouldn't wish that on my worst enemy.
I have my own anxiety things. Once it led me back to coming home for a semester from college, like doing an intensive outpatient. Also like having which I would be very interested how all this affects, like with everyone having autoimmune diseases now. I have lupus, and I've had times where I'm like obsessive with sleep. Like meaning like when I used to like not work for myself, I'd be like so obsessed with like so anxious about the idea that okay, I need to make sure I get enough sleep so I'm good for tomorrow. I need to, like so that I'd obsess so much that like I wouldn't sleep. And then, you know, everything's worse without sleep. So I like hear what you're saying in that a lot.
Yeah.
I like
And
it's horrible.
people say real I don't know if they said them to you, really unhelpful things like, well, a tired brain will sleep, so don't worry about it. And that's just not true. If your body is in a state of fight, flight, freeze, and you're releasing adrenaline and cortisol stress hormone, you can have a really tired brain that is unable to sleep. And so I love that you ask about, well, what is the antecedent? Because for me, the question was always, I have this game of whack-a-mole where these little moles are popping up, and how do I suppress that and make it stop? I'm going to try chamomile. I'm going to try Ambien. I'm going to try exercising a ton and tiring myself out. All of the behavioral changes that I tried for sleep. But it was focusing on solving the problem of not sleeping when not sleeping was my body's solution to the antecedent, which was saying yes and making choices to things that were deleterious for me in the long run.
Wow, that's interesting when you put it in like you thought that was the what how did you put that? As if it was the solution, one of them, or the
Yeah. Yeah, I thought that I was solving the problem by trying to suppress my symptoms into sedation. All right, just use naturopathic medicine and allopathic medicine and behaviorism to try to sleep. But that wasn't the problem. It was the symptom of the problem. Like your dog howls. Well, it's not for fun. Maybe it will be. But maybe your dog is hungry or scared or he has pain, right? And so we want to actually treat the cause. We want to solve the problem as opposed to the symptom being the
that's
problem.
I mean, that's like the complete behavioral approach that we always talk about when we're looking at behaviors.
Yes.
Like what is the function of the behavior? Like what is it, right? Why are
Yes.
they doing that? This world is deterministic. Nothing happens out of nowhere. So,
Yes.
sorry, I'm
Right.
like a walking textbook for this test. I've been teaching it, I guess essentially studying for over the last 9 years because I've been teaching it so long. So, don't mind me.
I'm
Okay,
taking notes. I love
you
this.
are? I mean, this is like
Yeah.
what we do all the time. So, okay, so
Yeah.
anxiety is obviously at an all-time high. At first, I remember people being I mean, not at first, just like what I was around being like, "Okay, Leah, you're like a Jewish girl, a Jewish Ashkenaz girl." The anxiety, like, amongst, like, generational, everyone, whatever. But I think everyone has anxiety. Like, I don't I mean, if you are human, you have anxiety. Why do you think anxiety is at such an all-time high?
There's a lot of reasons that I very much see exactly what you're describing. There's a few that come to mind as primary, and one is that in our brain and in our nervous system is that we have largely stayed the same as our ancestors who were like chilling in caves, right? So the human brain and nervous system doesn't evolve very quickly. We're able to evolve and adapt thanks to our microbiome by and large and epigenetics, but really the brain that we have is very reptilian. And the amount of stimuli that we evolved to deal with is whoever is around you in your proximal environment and the information that you get in your proximal environment. was quite a lot smaller and a lot less versus this morning when I got on my computer when I got to work. I had information from the BBC, and I had push notifications, and I had the New York Times, and I had 10 texts and 500 emails and lots of people coming in. And so we have all of this stimuli, all of this news, especially with the amount of sensationalism there is in the news, lots of big feelings, lots of clickbait, lots of headlines. All of this is coming in. And so in our brain, we have something called the salience network. And the salience network, its job is to act kind of like a pasta colander. You know, you make pasta
Uh-huh.
and you're rinsing it and the water runs through. Our salience network is like that. It's supposed to look at all of the data coming in from either in the body, interoceptive information, or outside of the body. And it's supposed to filter what's relevant and what's not. And we get over 50 billion data points per second, and we can't process a
Over
60th.
50 billion?
Yes. It's amazing. It's insane. And so when in doubt, send it on. It's like, I don't know, I can't handle this, but I don't want to miss something important. So it sends it on to the emotional processing part of the limbic system, namely your amygdala. For those who are like, these are big words, think of Amy has big feelings. Amy, the amygdala, has big feelings. It's the emotional processing
Uh-huh.
part of the brain. So Amy gets all this information. It's like a fire hose to the face. Amy's like, I don't know what to do with this. When in doubt, send it on. So then we get an activation of the stress cycle, the hypothalamic pituitary adrenal axis. And so now we are running around with adrenaline and we're running around with cortisol. So that's one thing, is just the amount of stimulatory input. And it's just one little piece of the puzzle that I especially see. What do you think?
Can I tell you what my current anxiety is?
Yes.
I just need to get this off my chest. Because as you're talking about this, first of all, anyone who knows me, I think the average person, if you say 5 billion, what's the
Yeah.
number?
Yeah.
50 billion per second?
50.
Something
Yeah.
crazy. I think that I honestly have double that. Like something like I know that I am, and I actually like thrive on it a little bit. But like right now, for example, my current anxiety, like not even kidding. And it sounds so dumb and so first world problem. I'm just saying that ahead of time. Okay. So for anyone, sorry. This Black Friday time with these sales and everything going on, I'm genuinely like anxious and stressed about it. I'm like I came into the office this morning and I was telling Julia, who like does all our digital design and marketing stuff, and I was like, honestly, I'm like stressed about Black Friday. She was like, no, we have everything prepped for the sale, like for our company sale that she's talking about. I was like, oh, I wasn't talking about that at all. It's like I am having to go through inventory of every item I might need for like, and they're coming in these sales everywhere. Like now Skims is coming at me, now Nordstrom's, now like, oh, maybe I do need more foundation. And then like I put my iPad on this morning. It didn't turn on the exact second. I'm like, oh, maybe I need a new iPad. Like, and I can't chill for a second. And then I'm on that and I'm like, I'm hosting Thanksgiving. I don't have time to think of these. Like, I'm saying the amount of input coming in at any given time
Mm-hmm.
is wild. Like, and I feel my biggest problem is, and I feel like I must do something with all of it. Like, not just like, let me leave that text there for a second. Like, you saw me, even when we got on the show, I was like, Martha, okay, we changed it to 12. Because God forbid I leave this person on like the text on red, because what if I couldn't focus with you if I knew I had that like outstanding.
Yeah.
Everything you're saying is so spot on.
Yeah.
It's crazy.
So what do we do about that? It's so when you're getting this deluge of information, I think that the Black Friday is a really timely and relevant example.
Even though this
It's because,
episode's probably going to come out in April, but you know,
you know what, there'll be another sale in April. There'll be like the April
Easter.
showers sale.
Yeah.
Yeah, Easter sales.
May,
So
Memorial Day.
yeah, there's going to be Memorial Day sales, and they're going to be, and the way that the marketing is done isn't just like, hey, we have sofas and they're 30% off. It's more like, don't you want to have the best for your family? You don't want to miss out. Maybe your old sofa is off-gassing fire retardant. It's like all so big and so
I
emotional and
know, like,
so
fuck off.
last second. Yes. And so it's like, what do we do with that? Our brains, our bodies, our nervous systems, plus whatever our encoding is. And so, like you were saying earlier, we have our own tint of sunglasses on. And so that's the lens through which we see the world. And that is what was programmed in us. And so if, like me, I came from a lot of poverty as a child. And so when I look through those sunglasses and I see all those sales, I'm like, I have to get all of the things now because I might not be able to afford it in the future, which is something that my 10-year-old self is thinking. But my adult self is like, I got to shop. I'm stressed, but I'm not aware of that meta antecedent, right? So for you, do you have an impression on what that antecedent is?
For me,
Yeah.
I think a lot of things for me, like, stem from, I have this, like, I've seen my life, like, taken from me before with my health. Like, I've been hospitalized for, like, 4 months at a time, people, like, wiping me, dressing me, and I have this thing that it's like, it could all be taken from you in, like, one moment. You kinda have to, like, do it now, like, so
Mhm.
it's like, I don't know, like, I'd have to explore it more, but there's definitely something there that's like, okay, well, you could do it now,
Mhm.
or always making sure, like, am I planning for the future? Like I'm a single mom, I'm running, like, a business. My health is okay now. I have a chronic condition that I've seen it get in bad places before. So I think there's, like, something there for sure.
Yeah.
I mean, then, like, the anxiety mixed with, on top of that, I'm like, this consistent need to be productive, like, while I'm feeling healthy. I feel like I'm consistently on a, because I never know when I'm gonna be in the ER again. And, like, it does happen, like, every month and a half or whatever it is, you know? I mean, not to, like, the insane, like, to the level that I told you I was very sick, but there's something there for sure that is, like, always, I
Yeah.
don't know.
Yeah. Well, I honor that. And so there's this foundation. There's this sense of urgency. You know what it's like to have your power taken away. You know what it's like to feel unprepared. And then there's this self-doubt. And so there's this urgency, and you have this part of you. And this part of you is very analytical. She's looking at all the possibilities. She's looking at all of the redundancies. Like, if this doesn't, then that doesn't, then that doesn't. You have a lot of pressure. And so there's this protective adaptation that, when then given all of this stimulatory 100 billion data points in, is that it feels like I have to do something with it. And so that's a really great example of how your stress and anxiety are trying to protect you. And if we just turn off the iPads or turn off the phones or the TVs or the internet or whatever, that you're no longer being informed about it in that way. So that's why the suppressive model doesn't work, or the avoidance model doesn't work, is that in your body's kindness, it's like, hey, we've been through some shit, and here's how it's affecting us, so that you then get to change and heal and unpack. And I teach you how to do that in the book. There's an exercise that, for just like real time, that you can use is, have you ever done havening before?
No, how are you saying that?
Havening, like a safe haven. It
No.
used to be called amygdala de-amplification.
No, but tell me about it.
It's behavior, bitches.
Hey guys, it's your favorite bitch, Liat here. Are you stressing about taking the BCBA or BCABA exam? Feeling like you don't know where to start? You got into this field, you're worried, your program didn't prepare you so much, you're wondering how you're gonna get through grad school, then let alone take this test? Well, let me take that stress on for you. Over here at Study Notes ABA, this is what we do. We eat, breathe, sleep, thinking about the BCBA exam. I've been carrying around my Cooper book for the last 8 years so that you can chill. If you're getting ready to study and wondering what you could be doing, sign up for our live collective. It's 12 weeks, which is done over 24 classes. We meet twice a week. It's taught from actual BCBAs who have been there in your shoes studying for the exam. We make everything relatable, funny. you are actually going to enjoy the study process. And hold me to that. If you're not enjoying it, let me know. I'll be shocked. You get a study group, people who are studying the exact same thing, shared adversity. We could ask all your questions, and we take all the notes with you. You are going to have the most beautiful doodles by the end, and your Cooper book will seem way less scary. Are you worried about payment plans? We've got that too. We get what it's like being an RBT in the field. So stop stressing, start getting ready to pass the test, and go to studynotesaba.com/collectives, and we have it all there laid out beautifully for you.
This will be valuable for everybody who's listening to this. And I know a lot of people who are listening to this episode, they have testings and exams coming up.
That was my next question for you. I wanted to ask you. So if you're giving this, by the way, I have thousands of people going through the test a year with us.
Yeah.
I am consistently answering DMs, people who are either taking it for the first time, very nervous, or they've taken the test, they've come into contact with the consequence of not passing. So now going back in and doing that again, I mean, even the numbers show like a lower pass rate after that, I think, because there's so much anxiety involved.
Mm-hmm.
Give me any strategies or advice that you would give to someone who is studying for their boards. Yeah.
Yeah. And I very much wish I would have had this technique when I was taking my boards. So this is relevant if we find ourselves getting really anxious or really stressed about Black Friday or about our health.
It sounds so ridiculous, my Black Friday example. Relatives. I get it. It's
suffering
ridiculous.
Is suffering. I honor it. I honor your suffering.
I literally what a first world problem. Shut up, Leah. But we're good. Okay, let's keep going with it. It's relevant.
Like, don't mention it again. Yeah. So, or you're taking your exam or whatever it is, is just notice it. And then havening you can do by alternating between step 1 and step 2 and step 1 and step 2. And you just are going to repeat step 1 and step 2 until you feel the way you want to feel. So I'll teach you these steps and I'll try to teach it to you in a really short amount of time. So step 1 is you notice the yucky, whatever it is, I have test anxiety, or I feel despair that I might fail the test, or I'm scared about going to sleep tonight because what if I don't sleep, or I'm getting on an airplane, or I have heartburn and I get health anxiety, whatever it is that's the yuck. And so what I want you to do is, in a place where you're not driving, in a place where you aren't going to be interrupted, you're going to just notice the yuck, and maybe even set your phone for like 1 minute. Set your alarm on your phone, and you're going to notice the yuck. And when you notice it, you're going to notice what it feels like in the body, what the thoughts are, what the emotions are that's coming up, and you're just going to acknowledge it. Because what we deny will amplify, and what we suppress will express. So the first step is to simply notice. Then your alarm is going to go off. And then you might set your alarm this time for 4 minutes. Maybe we alternate 1 and 4. And so then during the second set, you're going to do a touch and a logic. So stage 1, step 1 that you're alternating with is you notice the yuck. Step 2 is the logic and the touch. So the touch part. The importance of the touch is that it grounds you in the present moment. It grounds the body. And the way that havening teaches the touch is it's really cool because it crosses the midline of the brain, which does all sorts of important things that help us with reprogramming our nervous system.
Is this the way you're doing your hands right now?
Yep. So there are 3 ways to do it. So for those who are listening who haven't subscribed to the YouTube yet,
what the hell are you doing once again?
What are you doing?
You don't want to create anxiety, but there should be urgency to subscribe.
Subscribe right now. Is you imagine dusting your palms off, and it's left and right, and it's just a nice slow left and right. Maybe you even hear the ASMR of my hands on the microphone. And you could do that. Another gesture that they teach is that you cross your arms like a butterfly hug and you dust your shoulders off. So you stroke from your shoulder down the top of your arm and you just repeat that. There's a third position which has the most beneficial research. I think there's a lot of nerves innervating, and it's the face, where you stroke from your forehead down your cheek to your chin, and you just, I even feel like taking a sigh. doing that.
No, I
Right.
literally I carry so much in my face. It's crazy.
So that's probably the place for you. So what you're going to do when you go to phase 2, you've just noticed all the yuck for about 30 seconds. Now you're in 4 minutes and you're going to do the repeated touch gesture, whichever you pick. And then you're going to do mental math. And so you might start by counting backwards from 40 to 0 by twos out loud. So you might say, okay, 40, 38, 36, 34. And you do that to 0. And you're going to do mental math exercises for 4 minutes. So touching mental math, A, B, C, D, E, F, G. Or
You could
you
be like
might,
doing 2 + 2 = 4, 4 + 4 = 8, 8 + 8 like
yes,
16. I'm not trying to brag.
exactly.
I could keep going if I need to.
You are really, really good at that. Yeah.
I could also do multiplications of 9, multiples.
I can't do that, actually. 9 is out of my realm. So you're going to do that, and then your alarm's going to go off. And then you're going to go back to step 1. You're going to notice the yuck, and you're going to notice what's different about it. You're going to set your alarm for about 30 seconds. You're going to notice what's different about it. Anything that changes is changeable. I'm worried about this test. I'm worried I'm going to fail. I'm worried something's going to go wrong. I'm worried I see the testing room, the testing center. They won't even let me bring in a box of tissues because what if I cheat? My nose is dripping, whatever it is. That's me projecting my test experience, by the way.
No,
And
I know exactly what you're talking about. I had just had 3 fingertips amputated, and they literally looked under my bandages. I was like, "You wanna look at that? Alright." But I,
yeah,
remember being like, there's just so much anxiety with that. Okay.
so much anxiety with that. So you notice that anxiety, and then you go back to phase 2, which is the touch and the logic. And if you want to get a little bit more spicy with the logic, is you can imagine going into your favorite store and what are 5 things you would buy, or what are all of your favorite
And now you
singer
brought me back to,
songwriters.
my stressors of Black Friday.
Oh no! So we'll do the logic. We'll do the logic.
Kidding. Wait, also just a quick question. When you're doing these things that are like is that called bilateral? What's the
Yeah, so it is bilateral
Is that what you were
because
saying?
in
You were
each
saying
of
you use some by something, meaning like both sides. Is that also the same as like when you're doing like when I've done EMDR in the past and it's like
this is so
crossing over
good.
the
The midline.
yeah.
Yeah, EMDR, we used to
But this
think
is
that it
not
was
crossing over the midline, the face one.
it's not, that's true. So I guess you could supercharge it. And so what we think is actually happening is dual awareness processing. So I'm aware of this memory or this projection if we're future tripping about something. I'm aware of this anxiety, the stomach upset. I'm aware of that. And we're activating all those different parts of the memory stores in the brain and in the body. And then we're pairing it with the touch. It's in the moment, in the moment, in the moment.
That's
And then
so
when we go,
behavioral, pairing it with the touch, making it
oh
not a
my God,
aversive stimulus. Okay.
yes, yes, it's totally creating an absurd pattern interruption. You can't just do it the same. It's creating a new pattern
We call that
interruption.
behavior chain interruption. I like that. Okay.
Behavior chain interruption, brilliant. And then when we do the logical piece, is what we're actually seeing in the research is this is creating reduced connections from default mode network into prefrontal cortex. So let's break that down really quickly. Is when we're anxious, we are in default mode. This is the car driving down the highway without lane change assistance. It's just cruise control. You can't take an exit, you just go. This is anxiety. This is people who are zoned out, dissociated, non-logical. That part of the brain overrides your logical part of the brain. So what this havening does is it helps shift us out of that. The way to turn on logical brain so that you aren't anxious and so you can take a test like a boss and not be hijacked by emotional brain is to do the touch and the mental exercises. So before you go in
When
and
you
do
say
the test,
is the mental math considered like actual logic? Like this is
yeah,
like
that's using your prefrontal cortex.
okay.
Yeah. So you want to wake up prefrontal cortex. So they live on a teeter-totter. You're either in default autopilot or your executive team is on board. And so when I fly, for example, I used to have a really bad fear of flying, is I would notice my body getting activated and I would when I learned havening, I started practicing doing math and Sudoku. And it was just amazing. I was like, oh, this math is getting easier the more I do it. And I'm noticing correspondingly my chest palpitations and my heart anxiety going down. And the more that I did that flight after flight after flight, is I need to use the tool less, because we're literally reprogramming the behavior of the brain.
I love that.
Yeah. It's so powerful, and it doesn't cost you any money. Every single person here can do it. It doesn't cost you anything.
Wow. Okay, that's incredible. So someone who I'm just thinking anyone going into the test, right?
Yeah.
Going in. Okay, so let's just take someone. I'm just thinking of like my most recent DM. Like Leah, I literally don't know what to do. I only have 2 attempts left. This is my 4th time. My score actually went down. I can't imagine myself getting back up and doing this again, going in, failing again. So you would tell them, okay, first, set a timer for a minute.
Yeah.
During that minute, if I get this right, you're not going in, you're just like noticing what you feel as opposed to the statements. Is it more like, okay, I'm feeling like legit, like a huge lump in my chest, like I can't
Yeah.
breathe? Is that what are you like labeling that?
Yeah. You can if you want. You don't have to. But I kind of think of it as if we were to go into that state and look around, kind of like you're entering a room, and you're looking around at the smells and the tastes and the feelings and the sensations and the colors and the words, everything. The more that you can grab a hold of all of those associations in the mind and body, those are going to come with you on the reprogramming journey. So the more specific you can be, the better. So I would say to that person is, write down the negative thoughts, describe the most terrible part of the memory or the image that comes to mind with you taking this test and failing. Maybe it's the moment that you got the fail, or maybe it was the moment when you sat there and you were filling out the bubbles, and you do that part. The more specific and comprehensive it can be, the better this will work.
Oh, okay, that makes a lot of sense because now you're like taking that negative experience and you're literally, and that's when you're reprogramming it essentially.
Yeah. And if
Wow.
you find, let's supercharge this. So if you find that it's really hard to get out of that, some people dissociate quite a lot. So they get stuck in this state of, okay, well, Leah, I tried that. I was able to get into the yuck, but it was really hard for me to get out of it and do the mental math. I couldn't even do 2 + 2. I'm just so scared. Is then you would pair things that ground you in the body. So, okay, I want you to get an essential oil or a perfume or a lotion, or I want you to get ice water, something that you can put on your face to activate vagus nerve, or hold the ice in your mouth. Some people, it's such a big stressor that they aren't able to pivot as easily. So incorporating body-based grounding tangible things, taste, touch, smell, sound, the breath, can help get us into that logical part 2 step.
I feel like I've done that with my therapist before. Something where it's like, okay, like you got to think of something that you could taste in that moment, that you feel, that you could touch, that
Yeah.
you smell, right? Like you're just like
Yeah.
coming down.
Yeah, would they let your testers bring in like a warhead or a ginger candy?
No shot. They literally didn't barely let me bring the band-aids that were covering my newly amputated fingers. I was like, I
Yeah.
think, you could have a snack in your cubby, I'm pretty sure, like in your locker.
Yeah. So
That's good. I
maybe,
have seen this whole sour thing. Is that true? The
yeah.
sour for anxiety?
Yeah, so you have cranial nerve 10, it goes through the root of your tongue. It's like way back there, and that's your vagus nerve. And when we stimulate the vagus nerve, that's the light switch to calm the body. So when the body is really big and Amy amygdala has all these feelings, Amy is not going to let you be logical, because we didn't evolve to have a conversation with a tiger when it was about to eat us. But we can override that by going straight to the body. And so eat a sour warhead or Sour Patch gummies or something really spicy to swallow and to get you in your state. And if they make you spit it out before you go in, at least you got into that logical state. And then when you're walking into that test, do your mental math. 40, 38, 36, 2 times 2 is 4. Do that while you're sitting down, and keep that door open to logical brain.
I love that. That is such like a practical solution that you could do on the spot and have it with you. That's incredible.
It's behavior, bitches.
Hey, behavior besties, are you trying to get your shit organized for the new year? Yeah, aren't we all? So over here, that has been my struggle for life with such severe ADHD that I don't know where to find anything. I need something huge in front of me telling me what I need to do next. And for some reason, I've always had date dementia. I made that term up myself, but it means I never know what date anything is happening or how to plan ahead. So we created the Snabba Badass Huge Calendar. It comes with, I mean, it's huge, like literally like as tall as you. So make sure you have a lot of wall space, and it comes with so many different color Post-its to fit inside the square so that you could plan your year ahead. It's a different layout than a regular calendar. It all goes horizontal so you could see everything that's going to be happening. Whether you're already a BCBA, congrats, and you want to plan your pre-auths, when you need to send things into insurance, different things like that, there's space for that. You can put your personal things, or if you're someone studying for the exam and you want to figure out when you should be taking different mocks, when collective nights are, when you need to be reading what, there's space on this calendar for everything. Now you just need to clear a wall and make the space, and then you could get the calendar too. If this is your year to get on your shit, be organized, fear no more, Snabba has it for you once again. It's like annoying, right? We have like everything. So head on over to studynotesaba.com and get the calendar now. So in your book, there's so many things I'd want to get to. I feel like I'm going to have you back for another episode also because I just have so many things here.
Let's do it.
But you talk about 9 types of anxiety and panic proof.
Yeah.
I know this could be a loaded question because it's like already asking 9 different things, but can you talk a little bit about each of these and how you determine these 9 types of anxiety?
Yeah. I want to tell you a quick story that I think will really hit a home run with understanding it. Is I had a really good friend, and I write about her in the book. Her name is, we gave her the name Charlotte. And Charlotte had just had a baby, and she was struggling with terrible anxiety. She had insomnia. She was losing a ton of weight. She was having heat intolerance. So she's like going outside and she's like not minding the winter here in Michigan. And I'm like wearing a heated vest and like 26 layers and I'm freezing and she's fine. And so she goes to the doctor and she's like, "Hey, doctor, I'm feeling really gross. I'm losing a ton of weight." And the doctor's like, "Oh, good for you. It's baby weight. You're losing it. Here's a Xanax for an emergency if you need it to sleep." And so she thought it was just that. So she's not getting better. And then I asked her if her doctor ran any lab work, and she said no. So she went in, got a second opinion, got lab work. And it turns out that Charlotte had a very, very overactive thyroid gland. And so she had hyperthyroidism. And hyperthyroidism causes so much metabolic activity from head to toe that it was what was causing her weight loss, her heat intolerance, her panic, her heart palpitations. And Xanax was treating the symptom, but it wasn't treating the cause because she didn't know to look at it like that. So the gift of the 9 types of anxiety helps us to look at our symptoms as a whole person, to try to uncover, like Sherlock Holmes, what the heck our body is trying to say to us. And so really quickly, there are 9 types and we'll go through them. And then there's a quiz in the book. There's also a free quiz on
Yeah,
the
I
website
saw that.
if you want to know. So you can get that and assess yourself there. And it just helps because it's so overwhelming. And when we're anxious, we don't know where to start. So this tells you where to start. So the first type is thought anxiety. This is ADHD, racing thoughts, distracted thoughts, brain fog, or maybe we just zone out. Number 2 is nervous system anxiety. This is muscle tension, headaches. This could be brain zaps. These are things that live in the nerves and the muscles. Raynaud's could be part of that. Is that people who have autoimmunity and have Raynaud's, they could also have panic and anxiety. And often if you treat the autoimmunity, the anxiety will get better for people.
Right.
So,
and it works like cyclical. I mean, it's both ways. It's like because the
oh my gosh,
stress
yes.
triggers the Raynaud's. It's
It's a bidirectional arrow.
oh my
right?
gosh, yeah.
And we are in such a siloed healthcare system, is that your counselor or your psychiatrist isn't necessarily going to talk to you about your fingers.
Oh,
And so
exactly.
this will bring them together. So that's the nervous system anxiety. There's immune system anxiety, which is when our immune system is out of balance, it can make us anxious, and vice versa. So this would be lupus, is an immune system condition. Also, that same chemical that gives us the itchy eyes, then runny nose, then the pollen in the air we react to, it's histamine.
I'm on that page right now.
Histamine. Yeah, you're on the histamine types, right? So that's as stimulating as adrenaline. And so some people, they're having insomnia and panic, but really they have a histamine issue. And so antidepressants and benzos aren't going to work if the histamine's not corrected. We have gut anxiety, which is gas, bloating, reflux, diarrhea, irritable bowels, a stone in the stomach. And we also know that there's a gut-brain axis and there's gut bacteria, and they all inform our moods and our thoughts. We have chest anxiety. This is anxiety that shows up in the heart or in the lungs, like my heart is pounding, skipping beats, I can't get enough oxygen, I hyperventilate. And then we have depression anxiety, which is anxiety mixed with depression. We have anger anxiety, which is anxiety with a lot of pitta from Ayurveda. Pitta is an imbalance where there's lots of excess heat and agitation and frustration. And then the last, which arguably should be an umbrella over all of them, is trauma anxiety. I have parsed it out though, because if, for example, your anxiety started from failing a test and you're having nightmares about the test and you're thinking about the test, then you want to do trauma specific therapy on that incident to help that specific anxiety. So I think we got through all of them, right? Oh, and endocrine anxiety, that's hormones. So that's Charlotte's example, is thyroid, cortisol, sex hormones like estrogen, progesterone, and testosterone. Those could all underlie anxiety and might be part of the root cause you find.
Okay, so I have two things from that. Hopefully I could keep them in mind. The one thing that you're saying is anyone listening who is in the behavioral space is exactly what so it sounds like, for example, Xanax or any benzos has become like the blanket intervention for anxiety for a lot of things. And don't get me wrong, like I love a Xanax, like when I'm like ready to turn off. However, when we're talking about treating something based on what is causing it, like we're like we talk about behavior, that all behavior has four functions: either attention, escape, you're gaining something tangible, or there's some kind of sensory component to it. So when like I go work with a new family, right? And the mom's like, I don't know what to do with my kid. Like, he is consistently, just like throwing things and breaking it in the house. And she's like, so I just ignore him, right? So ignoring would only work for the behavior if the function was for attention. But if this kid is doing this, if we actually try to look at it, I actually took some data and they're actually doing it to escape a task. Anytime you ask them to do any household like task or whatever it is, it's actually for escape. So you ignoring them is actually not treating the problem at all. Like, right, a lot of people's like default technology they go to is ignoring like problem behaviors. It's kind of the same as like just give everyone a Xanax, but like you're not actually treating what is happening here. So if it's for escape, we got to figure out other ways. Like, how can this individual escape in more appropriate ways, or how can we allow that to happen? So the same as like figuring out like what is the function of my anxiety, and I think that's why you like in the book talk about talking to it, being like, hey, what are you here to tell me? Is there something I should be checking in on? As opposed to looking at it as like, oh fuck, like I'm anxious again. But like looking at it, like how can we match the function, as we say, or the cause for this with the solution? So That's how I would compare it behaviorally. So we're speaking the same language, just using different words in the space we're in. And the second thing I want to say is, I know there has to be some connection. I always say, like, I was totally healthy. I ran 7 miles a day before. I heard my dad's cancer had come back. The next morning, I woke up unable to move, and that was the start of my lupus diagnosis. Like, I'm talking like I took it so hard, and I'm like, that just shows there's some body connection between, like, I can't obviously say for sure, but like as we talk about, like the temporal, like space between there was so close that it was like, okay, like now I can't lift my hands and dress myself, like all within one day. So like our body is obviously and you said this one thing which I loved. You said, what we deny, we amplify, and what we suppress, we express. So like it's going to show up somewhere, right?
Yeah.
It's crazy.
And I love that it's never too late to reprogram that. Especially if we can figure out what it's an adaptation to. Because really all of our symptoms are our body's attempts to keep us alive and to protect us and adapt. It's like you go to the north and you wear a warm coat, but that same warm coat can suffocate you and you can overheat if you then wear that coat to Cancun, Mexico, right? In the summer. And so perhaps that response, like in your specific story, I honor, is your body, your nervous system, your immune system somehow along the way identified this as an adaptation that was necessary and life-saving. But the sticky factor, or the way that it did that, if it wasn't equipped with everything to do it correctly, it's like you're building a car, but instead of tires, you have Cheerios. And it's like, well, we're going to use the Cheerios, right? So that adaptation isn't helping you thrive the way that it was designed to. So the question that you just asked, that I think if we had so much more time, it would be brilliant to dive in and unpack that, is what systems were involved in that adaptation that you woke up that next morning. And I'm sure if we tested your immune system cells, something would be different. If we test your gut cells, something would be different. Your blood pressure, something would be different. Your sympathetic activation would have been different. So those were all different because the body's like, we're gearing up for something. And so what informed that, that's where we would want to go. And so there was an activating event, that news, and what programmed that activating event. And you said you've done EMDR, and I feel like in neuroscience, that's one of the best tools that we've had that has become widely popularized.
But I actually didn't do EMDR for that, come to think of it. Like I actually did EMDR for two things. One, which I actually went for it about my fingers, I know we don't have so much time for this, but basically I had a gallbladder surgery, which resulted in coming out of the surgery with itchy hands. The doctors didn't read my medical records, and so my hands came out going frostbite. So like that, I had like this fear of losing fingers. So that was one thing. But through my session, they actually realized like a lot of this also goes back to my obsessive fear of needles, which like getting diagnosed with lupus, you're obviously going to be poked a lot more. So like now I could get IVs and whatever it is, which is like so crazy to me after this EMDR. But it actually talking to you, I'm like, maybe that's the thing that I actually need to work through, is like that event of like,
yeah,
right?
yes.
Like, interesting.
And for those who are listening, is when you read through the whole panic proof book, is you will get a panic proof protocol by the end of the book. So throughout the book, you're going to get immune system checklist questions, and then you're going to learn how to make your own. Well, we want to repair the immune system. Here's how to do that. You want to change the diet to repair the gut microbiome. Here's how to do that. These are the behaviors changes, which if I ever write another book, I'm going to be calling you because you're brilliant. That you can incorporate.
Really, in not too deep. Ask me like anything on the test level.
Ooh, behavior change and attachment is what I'm thinking of. Is your opinion on attachment patterns? So we're looking at all these individuals that feel that they have attachment trauma. And so how are our behaviors or behavior in cultures informing attachment?
Let's write a book about that. Listen, I always wanted to write one book. I don't know, whatever I could offer in that. But I mean, I've thoughts on that already, just because
Yeah.
like,
Okay, we're gonna do that.
we could do a chat on that off the show. I mean, even though people probably think it's interesting, but I think that's super fascinating. Attachment types and history and how that like that offering conditioning. It's all interesting.
Yeah, because we don't have, I feel like, good behavior informed information about attachment. A lot of it's just like the strange situation with Mary Ainsworth and the babies that like turned away versus the babies that like wanted the mom. I feel like it's like a black box we could open.
Let's do it. Or like the monkeys,
All right.
the monkeys and like I love all that. I also love monkeys. We have okay. We have things to do. I'm gonna have Martha reach out to you after this to actually talk about it because I think it's super interesting. But I know you're writing this historical fiction now, so I'll wait.
Yeah, give me 9 months.
Okay, cool. In that time, I guess I could have a baby or something.
Yeah, totally.
Okay, wow. There's so much I know, like, we're at the hour. I want to respect your time. And there's just so many things we went through today that are valuable. And I mean, there's actual takeaways, which I love when there's like a actual behavior you could engage in. Someone like, so taking away this, what did you call it? The havening. I was about to say habituating.
Yeah.
The havening.
Yeah.
I love that to take away for anyone who's just like, Julia's doing it back here. She's feeling it.
Yeah.
Dr. Nicole, can you tell everyone where they could find your book and all things you?
Come hang out with me on Instagram, my website, my YouTube, all the places. They're Dr. Nicole Cain, which is CAIN. And then the book Panic Proof is anywhere books are sold. You could also hint, get it for free at the library. And I have so many blogs and extra bonus materials. If you look in the book, there's a secret URL. And if you type in that URL, you'll get into a secret backend of my website. So definitely take advantage of all of that. And if you do read the book and feel like giving some words of encouragement, that means the world to tell my publisher to keep on promoting the book.
I love that. I love leaving positive reinforcement. That's what I do. So I am so happy to do that. And I mean, the way you put it together is just so user-friendly. So thank you for that.
Thank you.
Everyone, go get your copy. Go get your copy. Also, I know you could get it from the library, which is so nice of you to say, but this is a book that actually has different areas for you to fill out. So you're going to want to get your own copy. I'm just saying. Yeah. I know as an author, you don't want to force people to go buy it, but I can. All right. Well, thank you so much for coming on. I really hope that we could do like future collaborations in future because I just love all the things that you're talking about.
Same. We must. It's everybody here's our witness.
I love it. So thank you guys. You know where you could find us. And by the way, everything will be in the show notes that we're talking about here. So do not worry. And you can go subscribe to everything and get a copy of the book. You can find us on Instagram, Behavior Bitches Podcast, Facebook, YouTube, TikTok, everywhere, Behavior Bitches Podcast. You can find us on our website, behaviorbitches.com, where you could send us any feedback or guests you want on, topics you want us to cover. We really look at that, and as well as the reviews. So go leave a 5-star review everywhere. We live for that. That reinforcement is what keeps me going. So head on over there. And with that, thank you everyone for listening and tuning in every time an episode drops. It's fun. I love that I get to talk to the most interesting people ever. So thanks for allowing me to do what I love. And as always, love you. Mean it.
It's Behavior Bitches.